The international arm of the Vision 2020 initiative is focused on providing technical support and advocacy for the prevention of blindness worldwide, whereas each country has its own National Vision 2020 committee, and it is comprised of the Ministry of Health, international and domestic NGOs, and other public and private organizations, all focused on reducing blindness. Since the inception of the program in 1997, a lot of funding and resources have gone towards this cause, and one of their long-term goals actually is to improve quality of life through improving vision. As a global health student, this was something that was actually really interesting to me, and I wanted to take a closer look at how Vision 2020 has functioned as a developmental tool since it was brought into action, and whether or not it is an effective way of actually improving people's quality of life. I had the opportunity to travel to India for 2 months and conduct a research study at the Desai Eye Hospital located in the city of Pune. Desai Eye Hospital is a 200-bed facility and serves hundreds of thousands of patients a year. In addition to the main hospital building, it has a specialty wing with separate glaucoma, cornea, and retinoplasty departments to provide comprehensive eye care. It has 7 permanent remote clinics on the outskirts of Pune and also conducts eye camps throughout the western Maharashtra region. Surgeons conduct over 30,000 cataract surgeries per year completely free of cost. At the hospital, I actually had the chance to work with a very talented team of doctors, including Dr. Kuldeep Dole and Dr. Colonel Madan Deshpande. And Colonel Deshpande is the Chief Medical Director of Desai Eye Hospital, and he's actually also the president of the Vision 2020 program in India. And as a result, he was a really great resource to have, and I was able to learn a lot about Vision 2020 and its actions and its goals, specifically in the Indian context.
Good morning to you. I'm Colonel Deshpande. I'm President of Vision 2020, right beside the India branch. And this is an initiative for supplementing and complementing the efforts of the government to see that by the year 2020, the avoidable blindness comes to a sort of appreciably zero level. And we work for 3 initiatives. Number 1, equity. Equity does not mean only the gender equity, but social equity, financial equity, geographical equity, disease equity. So all those equities you have to cater for so that patients are given adequate quality. Second thing we do, quality. So what is required now is a sort of quality norms have to be are there, and we have to ensure that treatment has to be of highest quality. And third thing, Vision 2020 aims, or rather working for disease burden. As far as the HNSAC is concerned, we have been doing this charity work. About 70% free work we do, but we also inculcate quality in that.
Desai Eye Hospital started in 2000. The aim to create this infrastructure so that the backlog of needless blindness can be removed from the western Maharashtra region. So it started its outreach program covering mainly in the initial phases 2 districts. Now we are covering almost 5 to 6 districts. In this situation, the major barrier that was felt by the rural people as per the Andhra Pradesh eye disease study was the remote rural population is not able to access services.
Desai started the outreach program and conducts screening camps in a 350-kilometer radius around the hospital. The patients are screened at the camp, and ones requiring cataract surgery are brought back to the main hospital. Here they are evaluated in total and then undergo a quality surgery with lens implantation. The next day they are given a meal and, after a post-operative exam, discharged in the evening. Each patient is given a set of dark glasses and 1 month's supply of medicine, and the local ophthalmic assistants who conduct the camps are responsible for their follow-up examination. This project was specifically designed to look at the economic impacts on the patients and their families following cataract surgery. We chose patients who had cataracts in both their eyes and were functionally blind because of them. Our questionnaire assessed both the patient's visual function as well as their socioeconomic status. This survey was administered before their surgery during their initial consultation and then 8 weeks after their surgery so that we could measure any differences that may have occurred. Because many of the patients were brought to the hospital from the remote clinics, it was difficult to get them to come back for a follow-up interview. As a result, we actually set out to the outskirts of the city and to the surrounding villages to conduct our follow-up interviews in the patient's home. It was quite a challenge to actually track down the patients because a lot of times we didn't have a phone number or a detailed address, and usually we're just working off of a landmark or a major street name. And so we literally had to go door to door and ask people if they had heard of this person, or even if they'd seen someone wearing dark glasses, which usually led us to finding our patient. त्यातनं दिसतंय आता व्यवस्थित अंदूक दिसतंय का नाही तुम्हाला पायरी वगैरे चढायची असेल किंवा रस्ता क्रॉस करायचा असेल तर दिसतंय खड्डे वगैरे दिसतात. What we found though was that going into the patient's homes was actually really beneficial because we could observe firsthand how their lives may have improved, and many of the small changes that we were able to observe were things that didn't necessarily come up in our questionnaire, and definitely were not things that the patients would think to mention in an interview in a hospital setting. Overall, because most of these patients were elderly and didn't have incomes of their own, it was difficult to measure any sort of direct economic impact, but there were definitely indirect effects and trickle-down effects with the patients' families, and the patients themselves were definitely more independent and overall happy with how their lives had changed.
Question may arise why we are doing, one is to remove the blindness in the country. We also found that when we do cataract surgery, it has direct or indirect benefits to the family, financial benefits to the family, and that's what Vikram has been trying to find out with sort of a work which is doing the project which is happening.
This can be a very good advocacy tool so that more and more people will come forward to support us in this noble cause.